The Honourable Member for Huon.
Thank you very much, Mr. President. Before I give my budget reply as the outgoing Labour member for the fantastic electorate of Huon, I'd like to take the opportunity to congratulate the member for Braddon, Anita Dow, on being appointed Shadow Minister for Health, Mental Health and Wellbeing. Of course, Anita Dow is an accomplished health practitioner herself, and I'm absolutely certain she will do an outstanding job in her new portfolio. Excuse me. I also want to congratulate the fabulous member for Rumney on being appointed Shadow Minister for Parks and the Environment. It's the environment, our great national parks, that actually make Tasmania unique. And I'm really glad that they now get the attention they deserve by a member of a major party. Mr. President, the budget, by the government's own admission, is nothing more but numbers printed on a set of paper. There is no cohesion, there is no vision. But there is this ever-present slogan, securing Tasmania's future, that's been regurgitated for months now. The $2.5 billion of additional spending is substantial. Yet, what has the government to show for? This budget would have been an opportunity to initiate structural economic reforms. Structural economic reform is badly needed here in Tasmania, and we are lagging significantly behind each and every other state in that aspect. This budget could have been an opportunity to transition our health system from focusing on expensive treatment of diseases in hospitals to cost-effective interventions in the community. But there has been no impetus, no plan, no vision. Again, what we got is slogans and slogans only. This budget could have been a future-focused budget, getting our communities and industries prepared and ready for the effects of climate change, such as extreme weather events, rising temperatures in our oceans, coastal erosion, and catastrophic bushfires. But there is no plan on how this government is going to protect our community assets, our industry assets, and our World Heritage areas from climate change. There's no plan for the environment, none. There's nothing in this budget to even assess the state of the environment here in Tasmania. The last State of the Environment report was released in 2009. Now, a State of the Environment report is meant to be released every 5 years. All other states in Australia are doing it. The Commonwealth is doing it. But Tasmania is just ignoring its legal and statutory obligation. That's how much the environment matters to this Liberal government. It's just being ignored. This is not about hope. This is not about that everything is going to be all right. It really has to be about action. Action now. Mr. President, this budget could have been an opportunity to outline a clear plan on how this government is indeed securing our future. But it has left us with a slogan and has left us with increased debt. The spending will push the state's net debt from $460 million in the last financial year to over $3.5 billion in 2024-2025, so in less than 4 years, Mr. President. And let's be clear, we'll have to pay the debt off. We can't rely on the Commonwealth to bail us out again. The world has changed, and securing our future looks different to me. It sure looks different to the future generations of Tasmanians. Mr. President, this budget is not about investing in a better future and for a better Tasmania. This budget is just the legislative framework to patch up the many self-inflicted wounds since 2014. This budget is a squandered opportunity. Of course, you would expect me to talk about health. And no matter how you want to spin it, our health system is in dire straits. Our doctors, nurses, allied health and support staff can't be expected to work any harder. But this government does exactly that. The Treasurer, now Premier, has diverted $1.6 billion from our health sector since 2014. And the consequences are so obvious. We have the longest ambulance waiting times in the nation, the longest hospital waiting lists. Bed block in our hospitals and emergency departments are a national disgrace. Minister Rockliff's aim is still to make Tasmania the healthiest state in the nation. And honourable members will recall that I asked then Minister Courtney in budget estimate last year, is that still the government's plan? And the minister didn't know at the time and said, well, that's actually Minister Rockliff's portfolio, not mine. So the minister made a media announcement the day after and clearly stated, yes, you know, Tasmanian government committed to a healthy population target, 100% committed of the target to make Tasmania the healthiest population in Australia by 2025. And we have no intention of walking away from it. And that was released end of November last year. I'm just actually not sure what the minister's definition of healthiest actually is. So I'm going to ask him in estimates, plenty of time for him to get the answer ready and not to take that answer on notice.
The leader's taking notice, so she can send it through.
Mr. President, we have Tasmanians dying waiting for an ambulance. We have Tasmanians dying waiting on hospital waiting lists to see a specialist urgently or to have urgent surgery. We have Tasmanians dying in emergency departments waiting to be admitted to hospital. The cause of death is never waiting for care. The cause of death is never a health system in a crisis. The Liberal government stands for one and one only health ideology. It is clearly that healthcare can be rationed, and that it can be rationed by setting up waiting lists. Mr. President, there's not a single diagnosed medical condition that will improve by actively rationing access to specialist care after being referred by a GP as a matter of urgency. There just is none. If you're being referred urgently with an abnormal bowel cancer screening test, waiting is not going to improve your health. If you have cancer, that cancer will spread whilst you are waiting. Rationing by waiting lists has implications, and it does come at a cost. And indeed, Mr. President, that cost can be calculated, taking into account lost income and productivity while waiting for necessary surgery. The Fraser Institute in Canada has developed that methodology, calculating the private costs of public waiting lists. And I commissioned Wells Economic Analysis to write a report on that. How much does it cost? How much does it cost Tasmanians to wait just for elective surgery, the necessary elective surgery? So the cost per year for the last year alone is $120.1 million. It's a conservative estimate, just elective surgery, not for patients who are waiting to see an oncologist, not for patients who live in chronic pain, who need to see a pain specialist. not for patients who need to see a cardiologist because of a heart condition that's debilitating, just for surgery alone. $120 million every year.
Add to that the inconvenience cost when they turn up for an elective surgery and surgeons not there or whatever, and they have to all of that overnight cost that they are burdened with, and then having to go back.
That's exactly right.
All of that.
That's exactly right. So how about updating the Tasmanian public every year on the private costs of public waiting lists? That's a nice little project for Treasury to do. It can be done. The methodology is sound, internationally accepted. We've done it.
And there are tourist citizens.
That's right. So I will seek leave later to table that report.
Interesting to read.
If you are waiting in the emergency department for an admission to hospital, waiting does not improve your health either. You have a higher chance of a poor health outcome and death if you have to wait for more than 4 hours. The evidence is crystal clear. I also want to be very, very clear that our health professionals in our emergency department can't be working any harder. If there are no beds, there are no beds. If there's not enough staff, there's not enough staff. And there are consequences for that. And we don't have to have a look at the health dashboard that's now being released every month online. Have a look at the data from the Australian Institute of Health and Welfare on waiting times in public hospitals. And if you have a look at the data for the Launceston General, you will find that 90% of patients there will be seen within 28 hours and 32 minutes. 28 hours. 10% wait even longer. The LGH bed block is the worst in the country. You're waiting up to 28 hours, sometimes even longer. The national average, is just 13 hours for a hospital in a similar location on the mainland. It's the number 1 ranked hospital for bed block in the country. It's not a record to be proud of. Number 4 is the Royal Hobart Hospital. It's not 28 hours, it's 22 hours. 22 hours for vulnerable people who present to the emergency department who must be admitted, who are just waiting and waiting and waiting. And I will ask again, in estimates, how many patients have died in the emergency department whilst they're waiting to be admitted? And I don't want these questions to be taken on notice again and to get a lukewarm answer, 10 days later. Let's get back to the headline figures that got so much attention. A $10.7 billion investment in health, 900 million more than last year. Every Liberal budget is accompanied by a flood of press releases with flashy figures and inspiring initiatives. They always provide glowing headlines, and they always mislead. Political spin is the hallmark of this government, but trickiness at this level is really unprecedented. The $900 million figure was widely reported, but little understood. Because it doesn't actually mean the government will spend $900 million more this year than they did last. The actual increase is only $112 million. They get to $900 million by adding up the amount the new budget promises to spend over 2021-22 to 24-25 and comparing it with the amount the previous budget promised over 2021 to 2023-2024. Right? Both of those are projections, not actual spending. They are projections, not spending. So the minister's press release is comparing one set of estimates that may never have happened in the first place, with a second set that may not happen either. It's completely and utterly meaningless. Two major infrastructure projects are meant to be underway when it comes to health. It's the redevelopment of the Royal Hobart Hospital and the Launceston General Hospital. For the LGH, only 25 million are allocated this year out of an estimated total cost of $667 million. And at the end of the 4 years covered by this budget, only 78 million, or 12%, will have actually been allocated. Yet, the LGH master plan was the Liberal government's signature health policy. $580 million for a 10-year master plan. I remember the announcement vividly, because after reading the announcement, I was surprised to see the fine print, the footnote. And the footnote read, subject to Commonwealth funding. And I thought, that's the way to do. You just promise something somebody else can pay for. That's the way to do it. And that's really interesting, because your promise, that's your signature health policy, $580 million. Somebody else can pay for it. So you would hope there's an agreement in place that somebody else actually is going to pay for it. So honourable members will remember that I asked the question without notice whether before, during or after the election the Tasmanian government actually spoken to the federal government about funding the LGH. And the answer I got was that a phone call was made in June between Minister Rockliff and Minister Hunt. In June. So they've just made it up. It was just made up. But when I did some media on that, because it just wasn't sounding right, and when I read through the federal budget looking for the $580 million, and of course not a single penny was allocated, right? I did media on that. The Minister for Health, newly appointed, had to go out and say, mapping out the future of the LGH end of May, the Tasmanian Liberal government has committed an additional $580 million over 10 years to fund these next exciting stages. They've committed again. So if you're committed on the 27th of May 2021, why are you not committed during the election campaign? And there's another issue. All these election promises are meant to be costed, right? There's the Charter of Budget Honesty. We are submitting our costings to Treasury. So what was actually submitted? Nothing. And now we've promised $580 million here. Where's the money coming from? Over $500 million short. If you knew you were going to fund it after the election, submitted to Treasury for the election, it's a $580 million project. It's a reasonable expectation that you're being honest with the Tasmanian people.
Does it happen here?
Honest with the Tasmanian people. Nonsense. At the Royal Hobart Hospital, 44% of the announced total will be spent by 2025, but much is missing. The budget doesn't mention the critically urgent second campus on the former repatriation hospital site. That repat master plan was signed off and supported by all relevant health stakeholders in 2019. Since then, there's been absolute silence. It's not mentioned anywhere. And one wonders why the work on the master plan was done in the first place. Just to pretend to be doing something in that space? Our plan was to fund the repat master plan with $390 million, fully costed over 4 years, submitted to Treasury under the Charter of Budget Honesty. And we got called out for it, making too many spending announcements, spending commitments. It's badly needed. If you have bed block in the Royal Hobart Hospital because you don't have enough beds, because you don't perform elective surgery. You've got to build those beds. You've got to create the facilities where you can do elective surgery. There are patients with mental health conditions who are dying in the emergency department, committing suicide because the facility is inappropriate. You need to have a mental health precinct as planned, signed off by the stakeholders in the REPAT master plan. Fund it. We support it. It has to be done. Then, of course, there's the elective surgery blitz. You know, the fifth blitz in a decade. The government promises to provide an additional extra 29,300 surgeries and endoscopies between now and mid-2025. An extra 50 beds and funding of, $746 million over 4 years and $204 million this year. But the total funding for the whole health portfolio is only $112 million more than the amount in last year's budget. So where's the extra $204 million coming from? Either the money will not be spent, and we are already 2 months into the financial year, or there will be cuts in other areas. Which ones? The government will not say. It's all a bit odd because the funding figures of $246 million over 4 years and $204 million this year for elective surgery were released in the statewide elective surgery 4-year plan for 2021-2025. It's on page 13. And that surgery plan was only released 9 days before the budget was handed down. So there's no good reason, Mr. President, then, for the budget not to conform with the surgery plan. There's no good reason. So it all smells a bit fishy to my liking, but it gets worse. As I mentioned, the government has promised 29,300 additional surgeries. And the government is promising that by employing, and now wait for it, an additional 10 doctors. 10 doctors. So we have 7,325 extra surgeries every year. That's 183 per working week, considering that we have 40 working weeks per calendar year. That's 36 surgeries a day on a 5-day working week with 10 doctors. What specialties are we talking about? Once you need a team of doctors, for example, a surgeon, a surgical assistant, and an anaesthetist, as you would need for most of those operations, those numbers don't add up anymore. They just don't add up. So are we talking about cataract surgery using anesthetic eye drops, vasectomies under local anesthesia? Be honest with the Tasmanian people. So-called elective surgery blitzes don't work and often do more harm to the system than any good. So why is this government proposing it for the 5th time? It just doesn't make any sense. The harsh reality is that too many doctors and nurses are leaving our public health system. If you speak to the Nursing and Midwifery Federation, they estimate conservatively that around 30 to 50 nurses are leaving the public health system every month. Every month. We had over a dozen psychiatrists leaving the public health system in a year. In a year.
Something we can't afford this year.
In a year. No, we can't, remember, for Hobart, because we also had 108 suicides last year. 108. And if you compare the suicide rate in Tasmania, there has been over 30% increase of suicides from 2015 to 2021. And if you compare the Tasmanian data on suicides to the rest of the mainland, Our suicide rate is 30% higher.
And then there's the attempted suicides.
That's what we are dealing with. That's why our election promise was to appoint, an independent authority, independent Tasmanian Suicide Prevention Commissioner. Because what we're doing right now is not working. And never mind how much money you put into triaging systems. A triaging system isn't going to close the episode of care. It's great to have an accessible triage, system, but the care has to be delivered. It's not the allocation, it's the delivery of care by a clinician.
The outcome.
It's the outcome. But no worries. If you speak to medical students, you speak to nursing students, they don't even think about the future in Tasmania. They already know once they graduate, they're going to the mainland because of better working conditions and because of better pay. Nurses in the Tasmanian health system earn 30% less compared to what you would earn on the mainland. And the cost of living is the same. Housing is the same cost. We've just released, the report on the horizontal fiscal equalization scheme. That scheme was designed to actually compensate, public workers in public health, in public offices, with regards to the equities they have for pays. Why are we not paying them? But no, that's right. $1.6 billion have been diverted from health since 2014. Should have gone into nurses' salaries, allied health practitioners' salaries. Gone.
They're allowed to do that, of course.
Of course they are, and the consequences are obvious. No doctors, no nurses, patients waiting on elective surgery lists alone at a cost of $120 million every year. Burnout. It's penny-wise and pound-foolish over and over again. But not to worry, because the government solution is now to set up another medical workforce centre, another recruitment centre. Big announcement, that's lovely. I'd like to know what happened to the last workforce units they announced with great fanfare. 2018. Michael Ferguson, Minister for Health, fast tracking of Tasmanian health recruitment, retention and workforce planning unit. As one of its first actions, Cabinet has today approved the fast tracking of a dedicated health recruitment, retention and workplace unit. The new unit will be established within the first months of a re-elected Hodgman Liberal government to assist with the delivery of more than 1,300 new health staff over 6 years. The Hodgman Liberal government considers health a priority, and we are hitting the ground running. And that was 22nd of March 2018. It's not hitting the ground running, it's punching the wall, it's doing nothing. It's a standstill, nothing happened. Top priority. 2018 media release. There, of course, has been little support for paramedics, and there's been little support for our volunteer ambulance officers. Very little support. Ambulance waiting times are the worst in the country, and they have increased 30% since this Liberal government was elected. And waiting times in regional areas are particularly appalling. Ambulances are being diverted, leaving vulnerable patients untreated for hours, and the consequences are too often fatal. And I will ask that question essence again: how many patients have died whilst they're waiting for an ambulance? And I don't want to hear that we don't collect the data, because that's the answer I got last time. So there are 54 ambulance stations in Tasmania. Only 14 of them are staffed 24/7 by paramedic crews. A further 7 stations are double branch stations with a roster of a single paramedic 24/7 and ambulance volunteer support. There is not a single station with 24/7 paramedic cover on the East Coast, West Coast, on King or Flinders Island. Not a single ambulance station. So at least the governor's committed to increase paramedic numbers. And that's good, because we have a lot of graduates and they are leaving the state as well, because there are not enough positions for them. It's just not clear to me why this government decided to fund, less than 50 positions full-time if the demand is over 144 full-time equivalent paramedics. That's not my number, it's the Paramedic Association of Tasmania. And how is this government supporting our ambulance volunteers? My understanding is that over 200 of them have left the volunteer force. Over 200 of them. How do we support them? Because they actually want to help their community. They don't want to be diverted to help out in other areas. They want to stay in their communities. But too often that happens. And there are flow-on effects. If all the ambulances are ramped at the LGH that are allocated for Launceston, then ambulances from Scottsdale need to go and help out. And that's a volunteer crew. And Scottsdale is very busy these days. Very busy.
A lot of bike accidents.
If there's no paramedic there, what are the poor doctors doing there without any paramedic support? The honourable member for McIntyre asked, rightly so, how do we keep those doctors? Well, support them better. That's why we proposed a comprehensive health action plan, co-designed with the relevant stakeholders. Better supporting our over 14 rural district hospitals, better supporting our ambulance crews. Because the demand is there. This is not about rationing, it's about offering help when people need help. You don't want to be sick, you don't make stuff up.
It's got to be end-to-end planning, though, doesn't it? Like, the hospitals themselves have got to be able to have the capacity to deal with what's actually
Absolutely right. It's not only one thing. Health systems are complex systems. It's not a surprise. So you need to have complex system thinking, not slogan-based policy. That's the difference. So, Mr. President, I now want to make some specific points. Based on the propaganda leaflets the government has kindly provided with the budget papers again, I made similar points when the last budget was handed down. I might just start with the health pamphlet. And I'm really pleased that, this time there's again a disclaimer there, funding over 4 years, asterisks, over 3 years, over 2 years. I looked up, last year's one, there was, an asterisk for Commonwealth contributes to it. I suppose another one would be good, another asterisk for wishful thinking or in your dreams. In your dreams, Really useful. So here we go. Let's start, $8 million to support better GP after-hours access and reduce pressure on emergency department. Reads really well. Now, the package, of course, is very light on detail. The extending hours, package for GP surgery is just a pilot project for a year. The additional fund of round about $40,000, $50,000 is just going to pay for the overtime rates for medical receptionists, let alone for any clinical staff. Why? Why are we setting up pilot programs, setting up to fail? The demand is there. Do meaningful public-private partnerships if you want to take off the pressure from our public hospital emergency departments. You're absolutely right. Of the 165,000 ED presentations every year, 115,000 of them actually go home on the same day. They probably could be seen elsewhere. They probably can be seen in GP practices if we improve access, if we ensure they bulk bill. That's why we put a package out there in our election promise. Turns out that's going to cost you $28 million every year, not 8. $18.3 million to increase staffing in Tasmania's district hospitals as part of the SAFE staffing models. I can't believe it's in the budget. It should be a given. Of course there should be SAFE staffing models. How come there aren't any SAFE staffing models? Is this government telling me now they purposely underfunded small rural district hospitals and now they're trying to compensate for that because we start a rural health inquiry? Yes, you're right. Bed occupancy rate is only 44% on average in those small rural hospitals. Staffing levels really haven't changed for over 20 years. And I've read the internal reports about downgrading our small district hospitals to nursing-type facilities. It's the last thing we need. It's the last thing we need. But also, if you don't have enough staff in those hospitals, doctors will not take the responsibility for that. And if there's a reason for doctors not, wanting to work in rural areas or not looking after patients in small rural hospitals, well, it's often because there are not enough team members present they can work together with. In my own electorate of Huon, there are meant to be 2 small district hospitals in Dover and in Franklin. And staffing is an issue. Staff training is an issue. If you only have 1 enrolled nurse on duty overnight, this is not safe. How can that happen?
It sounds like, Mr President, that the member for Huon should have been putting out the opposition budget.
That's a very good question, because our health action plan actually has been released during the election, including the funding. Our package for small district hospital has been released, including funding.
How much did it cost?
How much did it cost?
More than this.
More than us?
More than this?
Yep. And you went to the election, with respect,
I did.
Offering to be the alternative health minister. And then here we are 3 months after the election, and you are running away. If you've got the answers...
Order. I'll just, if we don't play the man in this chamber, play the ball, just ask all members to keep it respectful.
But genuinely, if you do have the answers, where is your conviction? Well, if the answers are here,
well, the answer.
Very few people get the opportunity to be the alternate.
Order. I'll just remind members of Standing Order 99.8, which states that members are not to promote a quarrel with other members. So interjection's fine, but let's just keep it tidy. Remember, we're in the Legislative Council.
I actually don't mind those questions at all, Mr. President. Because compared to others, I don't have a copyright on good health policies, right? There's no copyright. And you will have listened to me stating in this chamber that I'm willing to work with the Minister in order to ensure health policies implemented by this government are sound, reasonable and supported. I don't want to politicise health. And it doesn't matter whether I'm here talking about health. It doesn't matter. That thinking, that knowledge is out there just to be used. And if your health minister had taken the time during the election campaign to have a debate with me, that probably would have been to the benefit of the community as well. If your government had reached out to the stakeholders I reached out to, you would have come with the same policies. Why didn't you speak to the Rural Doctor Association? Why didn't you endorse the policy of the Australian Nursing Midwifery Federation with regards to their workforce model, the way they want to recruit nurses, the way they want to recruit nurses into permanent positions? The science is out there. You just need to accept the science. It's straightforward. It's straightforward. And again, just for the record, our health policy is actually still out there, so is the health action plan for Windermere. But again, our rural hospital package, that would have included a $3.5 million capital investment for each and every of our district hospital, would have been $59.5 million. We also, with support and co-design of the Rural Doctor Association and the AMA, proposed a training package for 50 rural generalist doctors at a cost or investment of $6 million. On top of that, honourable member, we are also funding 85 nurse practitioner positions to ensure that nurse practitioners are located in each and every rural district hospitals to take the pressure off the medical doctors who are also working there. On top of that, we're also funding 50 scholarships for nurses to become nurse practitioners, because they all want to train up, they all want to do more. It is about jobs, it's about permanent workforce. And it's about making quite sure that our rural areas are not disadvantaged. Because currently they are. And that's why the life expectancy of rural Tasmanians is the second lowest in the country, just a bit better compared to the Australian outback. And you know what? That's not me saying this as, the last Shadow Health Minister. That's what the current Shadow Health Minister says. And that's what the last 10 have done, because nothing has changed. Nothing has changed. You pay the same taxes, the same rates, the same levies in rural areas, and rural Tasmanians are systematically disadvantaged over and over again. Over and over again. Because it doesn't matter. Rural Tasmanians don't seem to matter to this government. If they did, invest in rural health. So I'm pleased that the Honourable Member Honourable Lear actually mentioned the Medicinal Cannabis Access Scheme that was proposed in the State of the State address in March, promised to be fully implemented by the 1st of July. And as we heard, just a couple of days they're on their way. What takes them so long? The one-stop application process is an extra tick box when you apply to the TGA. It works in New South Wales. What is the hold-up? And how are medicinal cannabis products subsidized? Only through a THS pharmacy? Through a safety net? When patients want to access those cannabis products from a community pharmacy? How long will this take? What's the hold-up? Can't be that hard.
I saw some regs through, Mr. President, some regs come through sub-leg meeting today.
Yeah, well,
give effect, but
just about time. 1st of July was the deadline, big fanfare. And I don't want to hear because of the election there was a hold-up, couldn't do anything. That's self-inflicted. If you have a job to do, don't call elections in between, do the job. We talked about mental health telephone triaging systems, and I want to warn honourable members, this is not only about triaging, it's got to be about delivering of the clinical service. Now, I appreciate the funding for ambulance secondary triage is around about $130 per call. It's quite substantial. Compare that to, the average government funding, Commonwealth funding of a GP consultation just over and above $38. But it's not really about being referred from one entity to another. It's about a clinical service being delivered. That's how we improve health outcomes. Talked about the medical workforce unit, $5 million for deliver an additional 20,000 dental appointments statewide. 5 million, 20,000 appointments, that's $250 per dental appointment. That's what I pay when I see my dentist every 6 months for a checkup. What procedures are we talking about here that can be funded with $250? What procedures? What was the thinking behind that figure? Just to blow things up because 5,020,000 looks good? What's the data driving that? I just don't know.
The outcome going to be?
What's the outcome going to be? It doesn't matter, just having appointments. It's the same language about delivering things. You know, I remember the Commonwealth government was really good in stating that vaccines have been delivered. They meant this literally, delivered to the location, not administered in the arm. There's a difference. That's why I'm worried, you know, Secure in Tasmania is delivering our plan. Yeah, deliver the plan. It's the implementation of the plan. Ensuring we have the outcome, not delivering something. It's in the language, and that's me saying. $9.2 million to support the implementation of the end-of-life choice voluntary assisted dying legislation. Really welcome. And I remind the government that the Premier said, end of last year, there will be a delay because the UTAS is going to commission a report. There will be no penalty time-wise. It was meant to be implemented by the 1st of July, 2022. Now the timeline is end of October 2022. I don't know why that is. I'm going to explain that to the Tasmanian people who are dying, who want to access assisted dying, who were promised by the Premier there's not going to be a time penalty just by, you know, delaying debating the legislation. It's meant to be the 1st of July. I also want to remind the government that when assisted dying has become law, is fully implemented, it has to be universally accessible as well. Currently, palliative care is delivered at Calvary Hospital in Launceston, in one of their units. And I want to urge the government to negotiate with Calvary to ensure that assisted dying can be accessed in a facility that is run by Calvary Hospital. And if that's not possible, I urge the government to consider our proposal to set up an independent hospice in Launceston. Because Tasmanians will expect they have access to assisted dying regardless of where they live. And don't disappoint Tasmanians in their dying days. Yes, I'm still the member for Huon in the lovely Franklin electorate. The reason why I call it propaganda, because it is. I remember last year I said, you know, how the hunting field development was already delivered at the time. Delivery of the new hunting field land release project, a subdivision that will provide around 470 residential lots. That was for the last budget, delivered already the last budget. Surprisingly enough, at the time there wasn't even a development application lodged with the local council. So I'm actually pleased to see nothing about the hunting field development in the pamphlet this time round, because nothing has happened. The work hasn't even started. The cows have gone from the area, no cows anymore. But nothing has started. On the contrary, the only thing the Minister for Infrastructure did was, you know, threatening to take the local council to a planning tribunal, because what council asked was to have a slip lane attached to a roundabout just to compensate for the increased traffic. But it was the project has been delivered already last year, but nothing. I just don't know.
Community out of having a say.
I just don't know. I just don't. So it's in Huntingfield in my electorate. Schools, the honourable member for Elwick made quite a few pointed comments. Again, Bruny Island is also in my electorate, a lovely little country school. You know, very old school. They've actually used school buildings that were in other areas of the island, put them all together quite a few decades ago, same old buildings, you know, same issues with plumbing, you know, things fall apart, really hard to repair. And the principal is doing a fabulous job there, It's a great little school. But despite him being one of the oldest schools in the state, he doesn't have an increased budget to account for repairs. There's no compensation. So the principal needs to decide, do I fix up the plumbing that's 40 years old? Do I do that? Or do I spend the money in getting a support worker in who can look at one of the students who does have ADHD, who actually needs, full support during the day? He has to weigh that up. Plumbing, teacher support. Why can't we give rural schools an extra allowance to compensate for the increased repairs they have? Why would you penalize them? How attractive do you think that is for a principal to be a principal of an old school compared to a new school, where the repairs just don't occur? And yes, it's an island, and it's hard to have, staff working in the school. But, staff want to come because it's a good little school. But one of the teacher assistants had to resign. Why? She lives in the Channel area near Kettering, so she has to travel to the island, and the ferry ticket is over $30. And there's no allowance for school stuff. The Department of Education doesn't pay for the travel. And if you're on a teacher aide salary, over $30 every day for travel is substantial. Substantial. It's crazy. It's absolutely crazy. So the department doesn't pay for a ferry ticket for a teacher aide to look after, children with increased learning needs. And they somehow make it work. Country people expect life to be hard, but it shouldn't be that hard. And I've said over and over again, they pay the same taxes, the same levies, the same rate.
All government service workers on the island.
And they should at least be supported when they need to be supported. In my electorate, agriculture plays a major role. The government has an ambitious target to double the output of agriculture. There's little support for industry workers. There's little support for the industry. There's little support for the environment. We don't even know what the state of the environment is because the last state of the environment report was only done in 2009. And yes, the responsible minister says, wood is good, but when we had the bushfires in 2019 and the Ta'an sawmill burned down, and they couldn't get insurance again because they're in a bushfire-prone area, the minister was nowhere to be seen. Jobs gone, never to come back. Where is the support for those industry when they need the support? It's not that the industry caused the bushfires. Tourism. Not much for tourism in my electorate. Huon Valley Council asked specifically to fund certain projects, but there's no mountain bike park, no shared walk and cycleway from Huonville to Franklin. Roads, the only thing we got was a 10-day consultation period on the Huon Highway Corridor Plan. There's a bridge called Olds Bridge in Lucaston. Tourist route, cycle route. The gaps on the bridge are so wide, the honourable member for Ellery could park his bicycle in there. He would stand upright.
Do you know where it is?
Yeah.
No, does Ben for Elwick know where it is? He can go and test it.
So of course, children would not be riding their bicycles to school because they would have to go on the highway. And that's not safe either. Why can't we fix a simple bridge? Palvarata Road from Woodstock to Sandfly is it's the second only outlet road from the Huon Valley. So if there's a bushfire and the Huon Highway is closed, you are stuck in the Huon Valley. It was interesting to read the Lord Mayor of Hobart, today talking about what are we going to do when we have a bushfire in Hobart. Well, what happened when we did have a bushfire in the Huon Valley? Getting out is quite tough. If the highway is closed, they're stuck.
You probably wouldn't want to be going up through Pilferata if you
No, you can't know. And you know why? Because the gravel road is completely deficient. It's not safe.
Well-
you can't actually use it.
had all the forest areas that are up through.
That's right.
Well, the speed at which fire travels too.
So what are we telling people in the Huon who already had a bushfire substantial enough that industries such as forestry industries and sawmills don't get insurance anymore to rebuild? That's how prone they are, and we just leave those communities alone. Yes, the Huon Valley is a climate vulnerable community. It is a climate vulnerable community. I tabled a petition with regards to, erosion in a community of Garden Island Creek because of rising sea levels. This community is still waiting for an answer. The petition was tabled last year. I followed up on estimates. Nothing happened since. We had the bushfires in the area. And I had to ask last year whether a light tanker was going to be delivered to the volunteer fire brigade in Dover. Because they don't even have the equipment to keep the community safe. In Dover, volunteers. In Dover, where there are major industrial assets, Tassal is there, Huon Agriculture is there. If there's a major outbreak, if there's another bushfire, they're gone. They're not coming back. It's about protecting our assets. It's about climate change mitigation. It's about supporting climate resilient communities. And it's not good enough to say we are carbon neutral and have been carbon neutral for 5 years. That's not what I'm talking about. It's helping communities now from the threats that are obvious. Temperatures in our oceans are rising. And our communities are affected by that. It was front page news in the Washington Post. This government doesn't seem to care. It has major implications for the agriculture industry. It has major implications for recreational fishers. Major implications. It directly affects our way of life. No plan. No plan. Talk to the fruit growers, talk to the wine growers who were affected by the bushfires, who couldn't sell their crop because of the smoke. Speak to them. Where is the climate resilience plan for them? There is none. How do we support the industries that support our communities? I don't get any answers. Just to come to a close, Mr. President, Tasmanians will judge this government by its actions in the present and not by making promises about securing something in the future. Mr. President, the future is now, and it's about owning up to present responsibilities. It is about being accountable. Mr. President, I note the budget and seek leave to table the Wells Economic Analysis Report on the cost of elective surgery in Tasmania.
The honourable member seeks